Hello, I'm Dr. John McDougall. I'm a medical doctor. I run the McDougall program in Santa Rosa, California. I'm a board certified internist. I've been directly taking care of patients all of my career. Most of it has been focused on chronic illnesses, but we're dealing with an acute care problem that really is going to be a chronic problem, and that's the COVID-19 virus. It'll be this virus that survives and threatens us and our way of life, or there'll be a new virus. In fact, I suspect with global warming and increased population that this is just the beginning. And so it's time to get prepared for a brave new world. And I'm going to share with you what I know to help you make some significant changes in your life to not only prevent getting sick from the COVID virus or the future viruses that are going to be with us, but also ways to survive, even if you do catch it, to decrease your mortality. And they're going to transfer into a better life in general. I'm not going to be talking about any strange things. I'm not going to be talking about something that will cost you a lot of money. I'm not going to be talking about something that has any serious side effects. In fact, you should have been doing this 45 years ago when I first started talking about it. Let's take a look at some of the slides I put together for you and talk about this COVID-19 virus. So let's see what we got here. Yeah, have my picture there. Take a look. They're trying. I have to tell you, medical doctors are trying, but with all the well intentions out there, you really don't have much of a chance. Some positive things are being done to help reduce your exposure to the virus, but I think you have to take control yourself. I think you have to make some decisions on your own that'll get you through this. I suspect things are going to get very bad with this virus, and we've just seen the beginning in the United States and across the world. Maybe some positive things will come out of this. Maybe by the end, I'll be able to discuss some of those hopes that I have for the future. Everybody's trying, but they're not really making the kind of progress that you want to be made. So let's, coronavirus, the COVID-19. This is in a series of coronaviruses, and there are many more that have developed in the past, and there are many more that I suspect will develop in the future. This one is primarily dominated by fever as a symptom or a sign of the disease. People have a dry cough and they get fatigued and have muscle aches. It's kind of hard to tell the difference between the flu, other virus infections, the common cold, and COVID-19 unless you get a specific test for this virus. About 80% of people have mild symptoms. That's good. These are the healthier people, I suspect, and also younger people who are in general healthier. About 14% get severe signs and symptoms. And for about 5%, this is a critical situation. There is a test for this virus. And unfortunately, at the present date, which is the middle of March 2020, in the US, we have inadequate testing. Hopefully that'll change soon. This is not the SARS or the MERS virus. These would be the past viruses that have threatened us recently. This is a different virus. It's called a novel virus because it's new, and that's important. When a virus is new, we've had no previous exposures, no previous immunity to it, and that's one of the problems and why it is so threatening, is the fact that we don't have this particular exposure that gives us some resistance to this novel virus. There is just one virus at the present time. They think that there may be another strain, hopefully not, out there that may be milder. There's no vaccine at the present time. Estimates are that it's going to take a year, year and a half to get a vaccine, but you've heard all of this on the news. The flu, which I've written about, in fact, I have several major articles on my website at drmcdougall.com about the flu and why I personally and for my patients don't recommend flu vaccines. It's because their particular vaccine or type of vaccine, it applies to past viruses. And these viruses, these flu influenza viruses, they change. They have an ability to change their molecular structure, and as a result, the flu vaccines are made against viruses that have occurred in the past, not the current virus. And that's why flu vaccines are one of the few viruses that I personally don't get, my family doesn't get, and I don't recommend for my patients. But you can read that a lot more about that at drmcdougall.com. Just go to the search engine and put in flu or influenza, and you'll get my thoughts on the flu. I do believe in immunizations, vaccinations, and I certainly hope that we get an immunization, a vaccination for the various threats that we have in the future. I think it's important. I certainly believe that we're going to be oriented more in that direction in the very near future. The flu virus, as I mentioned, has what we call an antigenic drift. That means the antigen, the virus, it changes its genetic structure. And as a consequence, we really can't make an effective vaccine against the flu because we're dealing with last year's problems, or the year before, or 2 or 3, 4, 5 years before. Hopefully the COVID-19 will not have that kind of genetic drift, and we can make a vaccine against it that's very effective, like we have for measles and mumps and chickenpox and diphtheria and tetanus and so on. I mean, these are the kind of immunizations that I make available for my family. My November 2014 newsletter is one of the more important articles I've written about the flu vaccines if you want to learn a little bit more about it. The severe acute respiratory syndrome that occurred between 2002 and 2003, and we've really seen no cases, is a virus that we call COVID-2. And this particular virus, which I assume is the second virus in line, ravaged the planet between November 2002 and July of 2003. Now, people were very upset by this particular virus, and I've talked to folks who are dealing with the COVID-19 virus now, and they say, well, things were different then. We didn't have all the websites, and we didn't have all the reaction back then in 2003 that we have now. Well, that's not exactly true. We had a lot of communication. People were very worried back then. There were millions of websites dedicated to this SARS virus, this COVID-2 virus. One of the interesting things when studying the previous SARS virus of 2002 and 2003 is that the death rate, the mortality, varied drastically around the world. And I think this is directly tied to the way we eat. For example, in Toronto, where they eat the Western diet, the overall death rate compared to China was essentially twice as great. And I believe it was because of the diet, and we're going to get into that a little bit later. We have a lot to learn from the SARS epidemic of 2003. We also have a lot to learn from our previous epidemics of the flu virus. The Spanish flu, which practically everybody today still knows something about, even though it occurred occurred a century ago. There was an initial wave of this influenza virus that spread throughout the world in 1919, and it seemed to disappear in the summer, as has been predicted by some people in the recent past, what will happen to the COVID virus, but that wasn't the case. In fact, it came back the next year in 1920 with vengeance. The mortality rate was 10 times as great when it came back. Both viruses originated in China. COVID, they say, emerged from seafood and poultry market in Wuhan, China. Both diseases, as I say, occurred. They're diseases of animals. Now, consider, our animals live in very unnatural circumstances. There are literally hundreds of thousands of animals crowded into farm lots. And each of these animals has thousands of different viruses. So the intermixing that occurs and the opportunity to make a new virus that is able to spread to the Homo sapien and between Homo sapiens is great because of that circumstance of the way that we do livestock farming. Both are spread by coughing and close casual contact, and both are more virulent during the winter months. So COVID-19, what we're threatened with right now, is not the first, nor will it be the last. We've had H1N1, we've had swine flu of 2009. They killed a lot of people worldwide. They went away. And so the hope was that this virus is going to act the same way. It's just going to go away. Well, that would be my wish too, but I don't live in a world of hopes and dreams. Malnourished people, often the poor people, fared worse. Of course, in our world today, we have a very serious problem of people gathered together in large groups. We have 7 to 8 billion people on the planet, and a lot of people are crowded in conditions that are conducive to spreading viruses, particularly those who are less advantaged around the world. SARS is deadlier, killing 10 to 15% of the victims compared to 3% of the flu. Yet, over the course of the 2 years, the Spanish flu killed 50 million people. No medications are available for either viruses. Here it's been an entire century, and we have no drugs that will make this virus go away. Quarantine is of limited effectiveness, but it is the tool that you can use. Self-quarantining, self-isolation, they call it. Both are highly contagious before symptoms appear, and that, of course, concerns a lot of people, particularly Mary and I, who have grandkids who appear well, but they may have the virus, particularly since both of their parents are doctors and will be called to the front lines over the next few months, dealing with patients who suffer from COVID-19. One person, they say, can spread the virus to 2 or 3 others. Well, we don't really know. Certainly, it's a highly contagious disease, and if you have contact with folks, you're likely to have the virus spread to you, and there's a possibility that you may be able to harbor that virus and get sick. So you want to, one of your best hopes is self-isolation, distance from the virus. And as far as the comparison is concerning reactions over the last 100 years, well, in the United States, I don't know that they've improved that much from the SARS epidemic. They just kind of stuck people in wherever places wherever they could find. We, of course, have this heroic effort of the Chinese who built a hospital in 9 days that will house 1,000 people during their illness. And there are all kinds of plans in the United States as to how we're going to deal with the sick people, because our hospitals are not going to be able to handle all of the people who are ill. In California, I understand that they have decided that they're going to take over hotels if necessary. In the state of Oregon, that's a possibility too. They're making plans for a very, very large number of people to be ill and to need medical care. And it's important that you react appropriately to the medical care that's available, and you take steps, well, as I always say, to stay away from the medical business. And that means staying well. So the COVID-19, it has, as the British Medical Journal reported in February of 2020, here it is March, I'm talking to you, mid-March. The coronavirus, this COVID-19, has killed more people than SARS or MERS combined, despite the lowercase fatality. So don't be fooled by figures such as 10% die from MERS and 90% die from Ebola and 1/10% die from the flu and maybe 1 to 3% die from COVID-19. Hey, we're dealing with billions of people over lengths of time, and the ultimate consequence could be like the Spanish flu, which had a mortality rate of about 1%. Yet, over the 2-year course affecting the entire world, it killed 50 billion people. Whoa. The statistics actually are SARS is 10% mortality, and MERS is the one that's even higher. It's the 34% mortality. Oh. So, what are we going to do? What is my advice? How are we going to get a handle on this? And I hope you get some value of what I'm going to tell you right now. Isolation, I think, is your best hope. You're given information such as wash your hands or use various kinds of disinfectants. Well, you know, that's an effort that you should take, and I certainly support it strongly. Testing, as far as you as an individual, it's not going to make any difference. It will make a difference knowing whether or not you have the COVID-19 virus, as to whether you expose yourself to other people, like your grandparents. Of course, Mary and I are 73 and 74 with 7 grandkids, which we are going to make every effort to keep contact with. So getting testing will help the overall issue, the spread of the virus, people around you. But whether or not you're positive for COVID, it doesn't change the way that you're going to be treated or how you're going to act, unless, of course, we find that we have permanent immunity in those who have contracted COVID-19. And maybe they could go out on the front lines with people who still haven't developed immunity. That's a possibility. Washing your hands is very important. Adding a little bit of alcohol along with the washing. Make sure you wash thoroughly. The back of your hands too, and between your fingers. And the mantra is for you to wash for 20 minutes with soap and water. The solution to pollution is dilution. In other words, lots of water. And that's how you get rid of contaminants such as viruses. The soap may loosen things up, but it's just a matter of washing things away. Masks, I think that we're dealing with more of an availability problem than anything else when it comes to masks. And the idea is that if you're not an infected person, you don't need a mask. Infected people should have a mask because that way they will spread fewer droplets, which is the way that this virus is spread, is people cough and sneeze. I believe there's some other motivation going behind it, and that's the fact that masks just plain and simple aren't available for the people who really need them. If you have a mask, I think you should wear it. I think there's nothing lost in terms of adding that extra protection to yourself. But most important is to keep your hands clean. And what we've done is we've taken the effort, Mary and I, to wear gloves when we go out of the house. We have these kind of gloves, and we wear them when we have to go to various places like the supermarket. I think that's our best protection, is to wear these kinds of gloves. But I have to mention to you that you need to put them on with a little bit of care, and you need to take them off with great care. As you'll learn in a few minutes, Mary and I were both trained in sterile technique because we worked as operating room technicians back in our early years. And so we know how to put gloves on and we know how to take gloves off. And one of the things I don't want you to do is, after you have put the glove on and you're all contaminated, you got dirty gloves, is I don't want you to start grabbing your gloves from the outside and pulling them off. What you do is you pull one glove off, you pull one glove off and down, and then you reach over to the other glove with the inside of this glove, and you reach, covering the one glove, to pull off the other glove from the other hand. You can't pull off the glove from one hand and then touch the glove from the other hand. You have to learn sterile technique. And because this virus, it sits on what we call fomites. And these are objects. And so if somebody coughs or sneezes or in some way brings a virus into your environment, it gets on your silverware, your kitchen sink, your clothes, and it lives for a period of time. We don't know exactly how long it lives, but it lives for a period of time. And I think gloves are your most effective way. Just make sure you continue your sterile technique while you're taking them off. And you don't end up contaminating your bare left hand with your right hand by touching the outside of the glove. You cover it up and pull it off. As I mentioned, hopefully the immunity is permanent, and we can put these previously infected healthy people back on the front lines, and hopefully they won't be in a situation where they catch it again, because this virus has shown limited ability to change genetic makeup. So these are the things that Mary and I are doing. We're wearing our gloves anytime we go out, and we'll wear them. I mean, if we go we're not going to restaurants, but if we went to restaurants, we would do that. When we do go grocery shopping, we wear gloves all the time. And when we flew on an airplane a week ago, we wore our gloves. We also we wiped down our environment with alcohol swabs, like when we got into the airplane seat last weekend. Before we sat down, we wiped everything off with alcohol wipes. And then we were very careful about wearing our gloves and keeping ourselves protected. Now, even if the gloves aren't there to keep you from contacting the virus directly, what they do for us in addition is they remind us not to touch our face. And estimates are that people touch their face 50 times an hour. And I'm guilty of that. But if I have those gloves on, then it reminds me not to touch my face. After we take off the gloves, we do thorough hand washing. And we also use alcohol wipes that we thoroughly wipe our hands with. And if we're going to be in as I mentioned, an outside environment, what we're going to do is we're going to wipe down the chairs and tables, et cetera, that we're going to be in contact with. The goal is to avoid this virus. Now, if you allow people into your house, which we do a minimal amount of, you want to make sure that they don't bring in the virus or limit the possibility. You could have them wear a mask. You could have them wear gloves. One of the things that you might overlook is the fact that on their shoes is the coronavirus. Yeah. And so you can have them take off their shoes, but it could be on their socks. And so we have booties. These are the kind of booties that we used to wear in surgery when we attended various operations during our early career. We also have a mat that has disinfectant in it. And in that way, people can clean off their shoes before they walk into our place, our home. We also have a HEPA filter, which is supposed to clean up the environment. I think it's worthwhile that they tell us that the HEPA filters are very efficient at taking viruses out of the environment. Fortunately, we lived in a closed space where there's no ventilation from any other people or units. And we can keep our environment very, very clean. But we have to take the effort to do it. And we have to explain to people that this is the way we're going to behave, is we're going to avoid the potential to get sick. And that's what I encourage you to do also, in any way that you can. There are various disinfectants that are approved to use. We have the Clorox, and we use a hand gel. In fact, we use it mostly for other people, but we have some hand gel here. I know these things may be hard to get, but you can also just get some alcohol and clean up with the alcohol after you wash your hands or with the environment around you. So there are various disinfectants that you can use. We also have some wipes, some hand wipes that we take with us. And we wipe down ourselves, particularly our hands, and we also wipe down the space around us. Let's talk about some of the behaviors that you could change that may improve your immunity, ways that you can fight back. Now, this may be a time in your life when you really do want to have a couple of extra drinks because of all the stress that's going on, but chronic alcohol use or acute alcohol use increases susceptibility to infection. So if you were thinking about giving up alcohol, now is a good time to do it, and you've got another reason to do it. Sleep, you need rest. Skipping one night's sleep is not going to depress your immune system, but chronic sleep deprivation will. There's another side to this too, and that is if you sleep too much, you end up depressed, and that certainly isn't a good idea. You also may end up with insomnia by trying to oversleep. So my recommendation in general is most adults need between 5 and 7 hours of sleep. Children need more. Sick people need more. Pregnant women need more. Otherwise, get an adequate amount of sleep, but not too much. Exercise. Oh boy, this is, I know, going to hurt a lot of feelings, but I want you to pay attention to this. This is strenuous exercise, marathon running, triathlon running, long distance bicycle events, swimming events, where people really push themselves. And what we found is that kind of exercise decreases immune function. And this was shown way back in 1996. Many studies have been done to show that people, after they say run a marathon or a triathlon, they have an increased risk of infections that occur following this particular strenuous event. And so when people exercise moderately, as you see in the blue line, their performance is enhanced and everything's going along well. But when they overtrain, when they overexercise, they decrease the ability of themselves to fight the infection. Therefore, they have an increased risk of not only contracting, but suffering serious complications related to the infection. Sunlight. Now, sunlight is important. On the one side of sunlight, getting enough is, of course, important for your vitamin D levels. It sets your biorhythms. Sunshine is crucial for good health, and I encourage you to go out and get it. It also enhances your immune system. However, there's another side to this, and that is don't get too much. Researchers have calculated that 100 minutes of solar exposure, in other words, getting a sunburn, reduces your ability to fight infections. So a little sun, not too much. Coffee, this is one I didn't particularly want to hear about myself. Coffee suppresses immunity. Tea, which is Mary's favorite drink, may enhance your ability to fight infections. Herbs, oh boy, you're going to be confronted with all kinds of herbs to take. I am not an expert on herbs. I have all kinds of friends, but because I'm involved in what many consider alternative medicine, I have all kinds of friends who are some so-called experts on enhancing your health and your immune system, your cancer fighting ability with various types of primarily plants. And what we're talking about here is not supplements like vitamins. We're talking about plant medicines. And I'm not an expert on this, but I have one attitude about it, and that is that these supplements or these herbal medicines, they are likely to do you any harm. You could read the research on Google or go to the National Library of Medicine, read about various herbs and decide whether or not there's enough research for you to decide to take them. You can buy them in most grocery stores and most pharmacies. And I think it's an error that's probably reasonable to make, even if it doesn't do you any good at all. Like, for example, we picked up some echinacea, and let's see what else we got. Here's Sambusks. Yeah, I don't know. Never heard of that one before. Astragalus, Astragalus. Again, one that's touted for its benefits. Vitamin C, Linus Pauling. In fact, I did an interview with Linus Pauling on my radio show. And this Nobel Prize winner, of course, he said that if you take large doses of vitamin C, you will enhance your immune system and fight infections and cancer, et cetera. There is some evidence that taking vitamin C may increase your risk of cancer, but I think as far as vitamin supplements go, this is probably the least risky. And if you decide that you're going to add that to your regime, fine. Again, this is not my expertise. I offer it to you with encouragement to decide whether or not you're going to spend the money, which is relatively inexpensive. I certainly don't put a lot of faith in any kind of medicine, certainly not any medicine from the standard medical business, because there is none that will prevent the disease, and there is none that will treat the disease effectively, as far as we know. We're experimenting a lot with various drugs, but right now. And these, of course, are expensive, very toxic when they come from the drug companies and the medical business. Herbal supplements, probably pretty innocuous, and hopefully it will do you some benefit. Now, let's talk about what I deal with, and that's people who have chronic illnesses. I run the McDougall program, and that program is in Santa Rosa, California. It's a 10-day live-in program where we really get people to change dramatically. In fact, we have a 85% compliance rate to what we teach after a year, and that's been published in scientific studies, like, for example, the journal MS and Related Diseases and the Journal of Nutrition. We published our data on the adherence to our diet and also the effectiveness. We're able to reduce medications, like in this particular situation, diabetic medication. We get almost all type 2 diabetics off their drugs. If they're not truly type 2 diabetic, they're type 1.5. In other words, they have some insulin insufficiency. I'll put them on a little bit of insulin. And of course, type 1 diabetics absolutely must be on injectable insulin. So diabetes is a disease that's known to increase your risk of dying from infections. And therefore, you want to get rid of the diabetes. Well, I'm here to tell you, when you talk about the common type of diabetes, which is 90% of the diabetes, it's essentially 100% curable with weight loss. And the best way to lose weight and sustain that weight loss, along with the other advantages, are to follow the kind of diet that I teach, which is a diet based on starch, fruits and vegetables, which you can learn everything about for free on my website, which is drmcdougall.com. You've given yourself many excuses why you're not going to fix your diabetes. It's only a matter of taking a few pills or a few shots, not too inconvenient. You'd have to give up your favorite steaks and hams and cheese sandwiches and so on. You decide it's just not worth it to save your own life. But now you're scared by a threat that's immediate. And that is that you're at high risk for this COVID-19 virus and the ones to follow. Ladies and gentlemen, this is just the beginning. So it's time to get your health back. And one of the things that you can do easily is you can improve your health, not only if you're a type 2 diabetic, where you can cure the disease in essentially 100% of the cases, but in type 1.5 and type 1 diabetes, where insulin is sometimes necessary and always necessary, these people will also improve their immune system and their ability to resist catching and also surviving what comes in the future in terms of microbes. Many of my patients are on chemotherapy, and chemotherapy decreases the immune system. That's what it does. That's its job. And for example, women treated with chemotherapy for breast cancer have a decrease in white blood cell count, which is related to infection. Those of you who are on chemotherapy, you know one of the routine tests is to check your white blood cell count, your lymphocytes. You know, there are other virus and fighting blood cells. And the job of the chemotherapy is to suppress cell growth. Well, it's not all that specific just to the tumors. It suppresses the growth of cells in the immune system. So what do you want to do about that? Well, first thing you ought to decide is whether it's worth your trouble to take the chemotherapy. I have to tell you that in most cases, and I would like to exclude childhood diseases, childhood cancers, I'd like to exclude lymphomas and leukemias right up front, but otherwise, most of the solid tumors like lung, breast, colon, prostate, chemotherapy regimes are more toxic than beneficial. For example, with breast cancer, I recommend that people, instead of taking chemotherapy, women generally we're talking about, they depress estrogen function and production, which is what chemotherapy ultimately does. It kills the ovaries. That's how it works in breast cancer, is that they have their ovary function decreased in a more humane, healthy manner. Probably the healthiest way is just to have the ovaries taken out. The other way that people block estrogen function is with tamoxifen and aromatase inhibitors. I don't know what the effect of these drugs are on the immune system, but I can tell you for sure, most of the people who are taking chemotherapy shouldn't, regardless of this virus and regardless of what kind of condition they have. The chemotherapy is oversold, to say the least. If you want to read the research that shows the point that I'm trying to make, there are several studies that have been published. I will cite one here for you that shows that chemotherapy maybe shrinks the size of the tumor, but as far as you living longer, or even better, it falls short, to say the least. So you want to sit down with your oncologist or your other prescribing doctors. You want to ask them, does this really work? Is it doing me more harm than good? Because I know you're increasing my risk of getting and dying of, say, COVID-19 with this particular type of treatment. And I understand you're well-meaning. I understand you've gotten the false messages from the drug companies on many of these drugs. I understand you're a doctor. You feel obliged to treat. But, now's the time to really evaluate. Is more good than harm being done by what you're doing from the standard medical businesses? And so often it's not. But as I've talked to you about, and you can read my newsletter, my February 2015 newsletter, the American Cancer Society now recommends a diet in the direction of the McDougall diet as fundamental therapy for various kinds of cancer. And if you look at that particular newsletter, you will see articles that show an improvement in survival in colon cancer, breast cancer, prostate cancer, melanoma, all kinds of various cancers by changing your diet to what's recommended by the American Cancer Society. Of course, I've been recommending the same change for cancer since the early 80s. I take care of also a lot of people with autoimmune diseases, and the newest drugs are drugs that we call biologic agents. They suppress the immune system, and they do. They decrease pain, they decrease swelling. Whether or not they change the overall outcome of the disease is highly in question, and you need to realize that. This, in most cases, is temporary symptomatic relief for a great price, not only of your pocketbook, but also risks, side effects, etc. Therefore, I encourage you to learn about these biologic agents, to ask doctors specific questions about the long-term outcomes, not what happens immediately, and then to take the steps to cure your autoimmune diseases, which is probably the most enjoyable part of my medical practice, and that is taking care of people with various autoimmune diseases like rheumatoid arthritis, lupus, multiple sclerosis, all kinds of different problems. The autoimmune diseases, I will tell you, will start to get better in about 4 to 7 days of changing your diet. And almost all people who have active disease, their active disease will be gone in about 4 months. I often joke that treating diseases like rheumatoid arthritis and various other autoimmune diseases is similar to our benefits for problems so obvious as constipation. In other words, almost everybody gets better when they change their diet who suffers from constipation. Well, it's the same thing with autoimmune diseases, and you'll take the trouble to read about it and to deal with these particular problems and to put yourself in a situation where you're not going to need drugs that have serious adverse effects. Sometimes the drugs cost $40,000 a year just for the drug, or $150,000 a year just for the drug. Well, now's the time. Many of you have been avoiding me because it was only a matter of you suffering and you dying, maybe in 10 or 20 years, from rheumatoid arthritis or multiple sclerosis. But right now, you're faced with COVID-19 and the risk of a very miserable death almost overnight. So, hey, as I've mentioned many times during this lecture, this is just the beginning. And now is the time to get yourself ready, because it's not going to get better. Low-calorie, high-protein diets, like liquid protein diets, they've shown to increase your risk of infection, depress the neutrophils, lymphocytes, and the various virus-fighting cells in your body, depress your immune system. Don't eat these kind of diets. They have the effect of starvation that we talked about earlier, and also they have toxic elements to the foods. And so stay away from the low-calorie, high-protein, especially liquid kind of diets. This applies also to the Atkins kind of diet, the low-carb diets. They suppress the immune system. It's just not the Atkins diets. It's also, there are many, many diets that mimic the Atkins diet, like grain brain, and several others. You'll see as the popularity of these diets. They have, some advantage. They're very effective at treating seizures in little kids sometimes. But doctors who treat kids with ketogenic diets for epilepsy, they realize that there's extreme risk in terms of causing disease by feeding them all this meat, cheese, and poultry and fish. Yeah. So that's not the way to go. If you're on a low carb diet, there's a better way to do things. And for many reasons, it's a better way. And the COVID-19 is certainly going to focus your attention. Diets high in saturated fats and cholesterol accelerate the progression of viruses. Now, I know I have to apologize in some way because I'm concerned about this too, the use of animals in research. But, some valuable information comes out when you look at the various animal experiments that have been done. And this particular study was done on monkeys, or Marquesas diet. And what they did was when they fed them a diet and they had an HIV type infection, which is a simian immunodeficiency virus, when they were fed their typical diet of these simians, they had a much reduced risk of dying. Their survival is so much better. It's the dark line that you see there on the chart. And when you see them fed a diet that is typical of the American diet, about 40% fat, their survival rate is very poor, which is the dotted line. Now, you may hear people talk about saturated fat and not know exactly what they're talking about. What they're talking about is they're talking about animal foods, particularly, well, they're talking about meat, poultry, eggs, any dairy. These are your saturated fats. And cholesterol is only found in a significant amount in animal foods, not found in plant foods. So you're thinking, well, Dr. McDougall, he's asking me to give up meat, dairy, poultry. Hey, I always got fish. Well, you don't, because a fish contains fats that suppress the immune system. You know that. I mean, you remember cod liver oil and arthritis, right? Maybe you thought that cod liver oil oils your joints and that's why you take it. Well, cod liver oil works, which is of course an omega-3 fish fat. It works by suppressing the immune system. So you have less inflammation of the joints. Well, it suppresses the entire immune system. And so feeding fish oils and even feeding a high fish diet has been associated with more viral infections. You know, they say that eating fish is good for the heart. I don't believe that. They also tout fish for many other advantages, which I am very much in doubt about. And you can read about this on my website under articles I've written on fish. And besides that, you know, I've told this story before, and it's worth telling again. When I first became involved in the oceans, when I was 12 years old, there were a lot of fish. Now 90% of the sea life is gone. So just for the sake of fish, stop dealing in false facts. Recent research done on lowering cholesterol with the National Cholesterol Education Program. And what they found is that when you give a low cholesterol diet without fish, the fish suppressed the arm of the study where people ate the fish, it suppressed their immune system with an increased risk of infections. And they say very clearly, such alterations may be beneficial for prevention and treatment of atherosclerotic and inflammatory diseases, but may be detrimental with regard to host defense against invading pathogens. So fish should not be a part of your diet. The way to feed yourself, we're going to get to now, it's with a plant food-based diet. That's the way to put your immune system at its greatest efficiency by eating foods that cost less, no side effects, and have so many other advantages for people, patients, and the planet. And that's the approach that we want to take. I've been talking about the importance of diet on the immune system for a long time. Back when I wrote my first national best-selling book in 1983, the McDougall Plan, that's more than 36 years ago, I put in this particular statement that fats impair the function of the immune system, which means that you have an increased risk of viral infections and cancers. I knew that back 36 years ago, 40 years ago, and I've been talking about it a lot since then. I wrote a newsletter, which I encourage you to look at. It's on my website, drmcdougall.com. It's a June 2003 newsletter. And you'll read it and you'll think, hey, that was 17 years ago. Everything it says in there is just like the COVID-19 issues we're dealing with today. Well, this is a SARS-CoV 2 virus. That's what it's called, the COVID-2 virus. And, I was well aware back then of the problem. 17 years ago, I was aware of the problem. And I offered you the solutions back then. Face mask, well, that's something. But the way you want to approach it is you want to make yourself as healthy as possible, as well as isolating yourself from the virus. The novel coronavirus, new, just like when measles came into the native populations of America several hundred years ago. It wiped essentially 90% of people out because they'd never been exposed to the measles virus before. This is a novel virus. We don't have much built-up immunity. The story that is most popular and probably true, even though you'll find also all kinds of conspiracy theories out there to explain other reasons for the development of this particular novel virus. I think it probably came from the fact that we're raising animals in unsanitary conditions, billions of animals living together in crowded conditions with billions of different viruses. And oh, well, just a disaster waiting to happen. And of course, they blame the current problem to the wet markets, they call them wet markets, in Wuhan, China. But this happens all over the world. Articles, here are just several of them that have been published, which talk about dairy calves spreading novel coronavirus and cows spreading the virus and bats and various animals, pigs. And it's not just the animals that people eat, either uncooked, undercooked, or raw. We've got the same issues in our markets. We've got cattle raised and other livestock raised in crowded conditions of hundreds of thousands of animals tightly packed together, and those animals containing millions of different viruses. Stuff is unsafe. And I'll take my steak rare or medium rare. That's what I used to say. Here's a study that recently came out from Public Library of Science showing meat consumption is associated with the transfer of a hepatitis E virus. Now, there are all kinds of viruses. We've talked in great detail. You can look it up on the website. I started talking about it in May of 2003 about the infection of dairy products and bovine leukemia viruses and bovine AIDS-like viruses. So I was telling you about that back in May of 2003, that you are catching viruses from the foods that you buy in your local supermarket. Thank goodness we have such a wonderful immune system, and most of us are able to tolerate this. High carbohydrate diets. I told you strenuous exercise will suppress your immune system. But what we find is that long distance runners, triathlon runners and winners who eat a healthy diet, they don't have that suppression of their immune system. As a matter of fact, they find that a high carbohydrate diet not only improves performance, that's why the Boston, the Chicago, and the Honolulu marathons were won by people who ate high carbohydrate diets. For example, Kenyans and Ethiopians. 80% of their diet is based on corn. And that's the reason they win. It says so in the runners' magazines. Well, that kind of diet also enhances a runner's immune system, and they help prevent the suppression that occurs after strenuous exercise. But I wouldn't count on it. The healthy diet, it affects the ability to resist infection in many, many ways. But I can't count them all. You can go to Dr. Greger's website, nutritionorg.com, and he'll tell you all kinds of different things that different plants do in terms of enhancing your immune system, preventing infections and cancers and so on. And I think that's an interesting review. But the makeup of plants are so complex, and the way we interact with these plant phytochemicals are so complex, we really don't understand it. And to get the idea that you can isolate one of these particular nutrients out, say in a supplement, and feed it to somebody and solve the problem, I think is a really oversimplistic view, and one set up to cause more harm than good. We've discussed the various herbal medicines. Remember, they're not exactly supplements. picking on a particular food as the miracle cure or preventative for this COVID-19 virus, I think is an over-hopeful exaggeration. But you can pay attention to it. If you want, I think the overall diet is what you need to pay attention to. The main barrier to your infection is your lung mucosa, which of course its health is enhanced by breathing clean air and taking good care of yourself, and particularly eating well. People who eat poorly, for example, have an increased risk of lung cancer from cigarette smoking. So eating well protects your lungs from cancer and probably viral infections too. But more specifically, scientists have focused on the effect of diet on the organ that directly contacts the food, and that's the gastrointestinal tract. The gastrointestinal tract contains 100 to 10 trillion microorganisms. There are actually more microbes, viruses, bacteria, parasites, prions, all kinds of little bugs in your intestinal tract than there are in your entire body. Yeah, 104 more genes, 100-fold more genes in these particular viruses, bacteria that live, microbes that live in your bowel than are in the own human genome. Yeah. Well, when you eat a healthy diet, what happens is the one cell lining, it's just one cell that separates between the gut, where the food is, and the bloodstream. But it's a very intelligent lining. It decides what's going to go into the body and what's not going to go into the body, if it's healthy. And we know, in terms of the healthy intestinal tract, the ability to resist invading organisms and invading substances, even food proteins, which lead to autoimmune diseases. And you could read extensively about molecular mimicry and how eating dairy protein leads to various kinds of arthritis, including rheumatoid arthritis. You can read about that on my website. The important message that I want you to get is that you need to preserve the integrity and function of these cells that line your intestinal tract. And the way to do it is with a healthy diet. A healthy diet through various mechanisms, and you can go through the scientific literature and read all the details, unimportant. What you need to know is you need to have identity of the foods, which are so complex. The identity of the foods that are going to cause that intestinal barrier to be strong, active, fully functional. That's your main line of defense. And we know after intake of the Western diet that these defenses in the gut, this gut barrier is destroyed. And you're at risk. There are also all kinds of plant parts. Again, my goal here is to make sure you understand clearly that these plants are made up of so many different phytochemical substances. If we survive that long as a species, it'll be thousands of years before we have more details worked out. It's not important. The important thing to know is that the plants are right, and all the substances that are in here that have been identified by scientists that may have solved some of your curiosity or maybe even made you a better believer in the importance of food. Maybe you need the details. I don't. But there are many, many mechanisms in which plants will keep you alive and keep you healthy. And if you get an infection, will decrease your risk of dying. So let's get back to isolation for a minute and what I'm doing and what I encourage you to do as far as preparation. If you're going to isolate yourself, that means you're not going to be able to go out and buy food, either because you're afraid to or because of restrictions that are there, which are beyond your control. And so Mary and I have gathered 100 pounds of food, which is preparation for about 2 months of isolation. We can live for 2 months right here in our home without any outside contact with what we have in terms of food and water. It's not a lot. 100 pounds of food is just a couple of cases, the kind of food that we eat. And here's what you need. You need dried starch, like dried rice. Brown rice would be better. Dried potatoes, dried beans, various types of dried starches. And you need to have about a pound of dried starch a day. And that'll give you around 1,600 calories, which will be a minimal requirement to keep you alive and feeling pretty good. Even if you're a big person taking in 3,000 to 4,000 calories a day and you're overweight, you know, going on that 1,600 calorie diet is going to keep you functioning just fine, especially when it's made of the right kinds of foods. And you need water. You need about a quart of clean water a day just for thirst, not for cleaning or anything else, washing, bathing, just for thirst. Get a quart of water a day. And that's your minimum. And it's going to put some restrictions on you. But you need to know what you can buy, what we'll store with no effort at all. You know, if our electricity goes off and refrigeration stops, our starches are just fine. We need a little bit of heat to soak them up, or to soften them up. But I imagine you could even soften them up, and most of them, and eat them just by adding some water. These may be desperate times, folks. So I think you should prepare yourself. And I know your friends are out there, they're buying meat and milk and things that are going to be gone in a few days, particularly if the refrigeration goes out. Your food stock is going to stay for months, if you want years, because you eat the McDougall diet, which is based on starches, vegetables, and fruits, and doesn't spoil, doesn't require extra storage. I mean, it can, and if you get fresh fruits and vegetables, they spoil, but dried fruits and vegetables don't. And if you're going to live on starches, I want to give you some extra rules here. And that is, if you live on underground storage organs like potatoes and sweet potatoes, in other words, they grow underground, you can live on those in water alone. Maybe add a little extra B12 if you have some. But above ground storage organs like grains and legumes, you have to add a source of vitamin A and C. So I would get some dried fruits and vegetables to add a small amount. You don't need a lot, maybe a tablespoon or a teaspoon a day of dried fruits and vegetables to give you the A and C you need on a starch-based diet of above ground storage organs. Grains, legumes, you know, these are classified as seeds. Or you could choose below ground storage organs, which are like potatoes, which is known as the anti-scurvy vegetable, that have all the vitamins in them. And again, we've mentioned B12, and it's something that I always generally recommend, but there's no rush to figure out where to get it. It usually takes 20 to 30 years to run out of your B12, certainly 2 to 3 years. But at some time or another, you'll want to add B12 to your diet. You're going to be in situations where you may be out, you may decide you need to go to a restaurant, you may have various foods that you're not quite sure about. You want to know how to kill that virus. It's worrisome, to say the least. But the viruses generally die at around 7 degrees centigrade, which is 150 degrees Fahrenheit. And this was tested on the H1N1 virus. Again, there's much to be learned about the COVID virus, and these figures might have to change. But certainly thorough cooking is one of your defenses and one of your chances of eating food that is not going to infect you. So what are we giving up? Well, we're giving up stuff we shouldn't be eating anyways. Stuff we shouldn't be eating because it causes us to be sick with chronic illnesses. In fact, 80% of the illnesses in Western countries are caused by, and most of them are cured by, eliminating the common components of the Western diet, the meat, dairy, eggs, refined foods, etc. And I want to point out to you, and I've done this in other contexts, like your health. I mean, how important are these foods? Or climate change, which has been recently my focus of attention. I mean, how important is it to you to eat foods that are yellow and brown, are malodorous, distasteful? You can't even get them down without heavily salting them or putting all kinds of sauces, steak sauces and sweet and sour sauces over the top of them. You've been lied to by the meat and dairy industry, fish industry, the egg industry, etc., either directly or indirectly through the employees that they've hired, which are known as doctors, scientists, and dietitians, who have spread false messages to you about the need of eating these animal products. This is completely false. I have an entire website dedicated to this, and everything's free to read. So if you need the data, you need scientific research, it's there. So here we're facing the COVID virus. The whole world's in distress. We'll learn how to live as minimalists. We're facing an acute situation. We're learning that we as a people have the ability to gather together for a common cause, and that common cause would be planetary survival, human survival, survival of our grandparents, our children, our spouses. So we're scared. We're willing to act. And it's because of the desperate nature and the suddenness of this particular epidemic that people are making changes. And hopefully the behaviors that they learned during this virus will transfer over into something that's occurring that I believe is even more important, that is not being recognized, is given virtually no attention at all. And that's what's happening to the climate. Because it's slow, the death of the planet. Because it's so imperceptible on an individual level. Most of you haven't been affected directly by climate change. I'm one of the lucky few that went through the wildfires of California. Some of you went through floods and other issues related to climate change. But we've got to fix the climate. Maybe the COVID virus will teach us that we can change, we can save ourselves, and we can save the planet. And maybe when you as an individual, you figure out, because you don't want to get the COVID virus, you don't want to die from it, and you know now it's important, really important to change your diet, be as healthy as possible. Maybe you'll say to yourself, hey, I could do this for even more noble reasons, like keeping myself healthy and my family healthy, and maybe preventing extinction of all species on planet Earth. Yeah, there could be some good that comes out of this. Well, I've spent 47 years with a passion for food related to your personal health, your diabetes, your obesity, your high blood pressure, your risk of dying, your appearance. That's been my focus. I'm a medical doctor. I have to say, I've essentially retired from that. I've trained 3,500 doctors at least. And I'll tell you where I get those figures from. So there are lots of other doctors out there that understand the importance of a plant food-based diet. Most of them haven't really focused on the essential nature of starch, which has to be about 80, 90% of the diet, but they're learning. So, I've done my job. I spent 47 years doing it, wrote 13 national best-selling books, have lectured all over the world on this particular topic. It's time for me to move on. It really is. And so many of you know that over the last, 16 years, and certainly over the last 3 years, I've focused my attention on mitigating global warming. And I hope you don't take this wrongly, but I think the COVID virus is going to teach us a lot of lessons to save ourselves in the future from future viruses, microbes. Maybe we'll be just a healthier population of people that can function better. And of course, the damage that's being done to our planet. The other issues that many are very sensitive to, which I have continued to develop and actually become very aggressive about in my thinking, and that is the end of speciesism. And that is believing that somehow the Homo sapien is unique and above all else, and that other species of insects and animals and so on aren't just as brilliant. I've kind of gotten over that. Of course, I'm almost 73 years old, and Mary's almost 74. Well, hopefully you don't catch it. But if you do, I'll tell you what you ought to do, is you ought to stay home. Yeah. Don't go to the doctor's office. They don't want to see you. They're overwhelmed right now. You can give them a call. They'll tell you where to get tested. Hopefully there are some good testing centers so you can find out whether or not you have the virus. To give you more impetus to carry out the things that we've talked about during this previous time together. And that will be helpful in terms of the tests, in terms of controlling the virus spread over the planet and over the country, et cetera, your community. So I'm not trying to minimize this, but it's not going to make any difference as far as you're concerned personally as to whether or not you're going to survive this particular virus, knowing whether or not you have it. So if you're sick and you wonder whether or not it's a COVID-19, coronavirus 19, COVID-19, you can get a test to satisfy your curiosity, to make you do things you should already be doing. As far as your care goes, I would encourage you strongly to stay home and not go to the hospital or doctor's office, which are not only full of sick people, but also full of people who make terrible mistakes at authoritative positions like doctors and nurses and so on. I mean, keep yourself out of that system as much as you can. And that may mean, in addition to you caring for yourself or family helping to care for you, that may mean that you have to hire assistants from the outside to come in and take care of your house cleaning, your own self-cleaning and preparing your food and so on. And I would encourage you to do that. In the short run and the long run, it's going to be less financially expensive for you and expose you to less risk of a catastrophe. Believe me, if you go to the hospital sick, if available, they're going to give you everything they got, whether it works or not, because that's what the medical business does. It treats. Be careful. So there's no specific treatment for this virus. You'll hear about a couple of drugs, a couple of malaria drugs and anti-AIDS drugs that they say may have some benefit. They haven't been tested thoroughly enough. Hopefully they work. I would not encourage you to stockpile such medications. Hopefully through continued experiment with highly effective HIV medications, and they have been highly effective. We'll find something more specific to COVID-19 and maybe something that applies to microbe threats in the future, viral effects, threats in the future. Maybe something so common to viruses that we can deal with multiple threats through one specific maneuver rather than having to have a separate vaccine for each and every problem. Antibiotics won't stop the virus. It'll cause super-infections. You may develop a bacterial pneumonia that is life-threatening. So you don't want to get on antibiotics. Unless you have a super-infection, then it may be of help to you. Mostly the treatment is supportive. There was an article last week in the New England Journal of Medicine about whether or not high oxygen or low oxygen therapy reduced mortality. It didn't. Yeah. Of course, that's the first thing they're going to do for you if you're having problems with COVID-19. You're going to have respiratory problems. They're going to put you on some oxygen. Well, you can do that at home too. You can have your doctor order home-delivered oxygen units to your house. And if you think it makes you feel better, fine. But I don't think the research is there for improvement of survival. The next step they'll do is a BiPAP, which is kind of like a CPAP machine, more advanced. And again, your doctor can order one of those for you, can be used at home. And then the last step will be a respirator. I have to tell you, folks, when you are at the point where you're being put on a respirator, things are really, really, really bad. And you may place in your end-of-life instructions this is something you do not want to have done to yourself. I think it's something serious to consider, particularly in this circumstance, where if you're at that point of failure of systems, particularly your respiratory system, the additional more costs and pain to you by putting you on a ventilator is something I think you ought to seriously talk about with yourself, your family, and your medical team. If you don't eat, if you're not hungry, don't eat. There's a reason to fast. The body loses its appetite when it's sick because it's supposed to be recuperating. It's not supposed to be out gathering and preparing food. Try and drink water. When you get to the point where you can't drink water, you aren't interested in life, you can't eat any food, I mean, things are really, really tough, then your only step is going to be able to get hospital assistance. And I don't know what that's going to be in the future. That could be a tent, that could be a hotel, who knows what it's going to be. And then you're going to have to get that kind of support. But folks, this is end of treatment care. So, it may be something you avail yourself to, but do consider it as the last resort to let the hospital system get involved with you. Current medicine, remember it's March 2020. Hopefully we have some miracles come out in the next few years, but I wouldn't count on it. I would count on self-help things that I tried to share with you. And are you getting better? Well, when you get an interest in life, when your thirst comes back, when your appetite comes back, those are really good signs that you're recovering. But it may take a few more days before you're sure you're on the road to recovery. So I wouldn't jump right back into your activities. Well, you know, Mary and I, we're trying to keep ourselves healthy. We're in that age group called elderly, which can have a death rate from serious infections as high as 50 or even as high as 90%. And so we're concerned, to say the least. And I know there are no effective drugs out there. I know the medical system is not going to help me. So plain and simple, it's up to Mary and I to take care of ourselves. And those approaches, as I told you, are isolation, partial or complete isolation. And I have to tell you, we're progressing more towards total isolation to protect ourselves. And keeping yourself as healthy as possible with your eating and other behaviors. These are things that you can do to save yourself, to get over this. But let me remind you again, this isn't just about COVID-19. This is about the next microbe, virus, prion, bacteria, whatever it is, that sweeps across the globe, partially due to the fact that the planet is warming, partially due to the fact that we don't just have a few 100,000 people on planet Earth anymore. We got nearly 8 billion, and it's rising. We have this mass transportation. We also have mass communication, which may make our opportunities much greater than we've ever had before. I've seen cooperation. I've seen people getting together, interested in common goals. And I guess when things are toughest, people are at their best. I'm certainly going to be trying my best to help you and our family and anybody else who calls upon the things that I know best, and I've shared those with you about how to enhance the health of the body and some basic, simple isolation principles. And these are things you can do cost-free, side effect-free. And you can sit around and wait for the medical system to save you if you want, but I would encourage you not to do it. I'm going to have follow-up question and answer opportunities for those of you who want to know more about this. We'll either do them live as webinars or have you send in questions to info@drmcdougall.com. And I may end up doing a presentation like I did here, in other words, a self-recording. It kind of depends upon what your needs are in the future. I doubt that my recommendations are going to change much in the future. I think these are very solid principles. So I hope you've learned a lot from what I had to say, and I hope that things go well for you. I certainly know not only you, but our society has a much better chance if we start acting on the knowledge we have. We start listening, as you've heard over and over again, to the scientists, and start making intelligent decisions, not decisions based on politics and emotions. So I'm Dr. John McDougall. I can be reached at 800-941-7111. That's our call-in line for our clinic. And I would strongly encourage you to get involved in my message, which you can do for free. Our website is free. Yeah, pretty much everything that we do is, information-wise, is free for you. Recipes, instructions, recommendations, and so on. We also run 10-day live-in programs, which will probably be on suspension for a while. But that's the ultimate place to come and learn how to be healthy and get off unnecessary drugs. Many drugs which are suppressing your immune system and setting you up for other problems like cancers and infections. And our goal is to get you as drug-free and healthy as possible. That's what I really see working for you and for me. So I'm Dr. John McDougall. We're facing a brave new world. We're not going back to the way things were. Those of you who are still set in the idea that we're going to go back to the way things were, think again. We need new leadership. We need new ideas. We're going to live differently. I have 7 grandchildren. My plan is for them to not only have a life, but to have a great life. Thank you very much for listening.